What are the pros and cons of choosing orthopedics as your postgraduate branch?
Like I said, that is the biggest pro. The con part is that you will.
So, is this branch suitable for girls?
Why not?
Is orthopedics a saturated branch?
My personal belief is this is a myth. डॉक्टर्स की सबसे बड़ी कमी, we never know about the finances. हमें पता ही नहीं होता सैलरी आती है कहाँ जाती है नहीं पता लगता.
What are the business prospects in this field?
When you talk about the business prospect, it only happens when you're into the private sector because in government part you are not allowed to do that.
So, what do you think is the future of orthopedics after like 10 years?
That is going to make orthopedics much more better. So in orthopedics also, we'll be using AI, we'll be using robotics, but that solely has to be my decision till what part I want them to take over.
What would be your advice to a new JR1 joining orthopedics? How to handle the pressure, the toxicity of the orthopedics department? How much does an orthopedician earn? We are building India's largest community of medicos. We are on a mission and I need your help. First, of course, you have to subscribe the channel, and second, you have to help me find legends for this show. We will all be yearning for their knowledge and we will all make India better. Today's topic of discussion is orthopedics. So many myths are around this subject. It's a male-dominated branch. It's a saturated field. Is it really an end branch? Is this a good branch for females? To break all these myths, let's welcome our super legend guest. Yes, he is none other than Dr. Sushil Vijay sir, a very close friend. He has been a teacher and educator for almost more than 10 years. He's a practicing orthopedician. He owns a running hospital business, a multi-speciality hospital in Delhi itself. And he's going to break all the myths today. So let's put our hands together and with a huge round of applause, let's welcome Dr. Sushil Vijay sir. Welcome sir to our show. I think that's your second seating at the Nachiket Bhatia Show.
Absolutely, and I'm loving it. The way you have modified everything here, it's fantastic. Thank you so much for the invitation.
So thank you, boss. I believe orthopedics was one of the most demanded specialty, and students were, pestering me on a daily basis ki we want to know more about orthopedics.
Absolutely.
So I thought, who better than you for this thing?
No doubt, orthopedics always will be the love. But in the recent year, this year only, we have seen that students are more inclined towards the medical branches rather than surgical, and it's all happening just because of lack of information.
Boss, I think orthopedics is one of the most what we call as a male-dominated branch. So basically, we'll get to orthopedics a little bit later. For the start, we want to know how Dr. Sushil Vijay started his career. Why did he choose medicine as a career option? And how he became a doctor, then an orthopedician, then a faculty today.
This all started basically with my class 10th examination. Okay, so I had, my father is a chartered accountant. So I had both the subjects of maths as well as the science part with me. And science was good, pretty good. But maths थोड़ा सा ना वो ऐसा था गड़बड़ वाला कि I was not having much of the idea और समझ में भी कम आता था. And I was not able to tell at home कि पापा is CA and I am not getting maths. But anyhow, that continued. So 10th किया, फिर 11th के अंदर I scored I think 55 in maths. And all other subjects like of science, they were near to distinction part. फिर पापा realized कि maths is not his cup of tea. So I left maths in 11th. And that's how the love for this medical part was there. कि 11th के बाद bio, science यही समझ में आता था. That's how the journey started. So it was in 2002, I got enrolled for this MBBS part. And initially first year, I'm the first medico of the family. So first year में तो समझ में ही नहीं आया कि कैसे चला, क्या हुआ. Like every medicos, like life is same. For second year, I realized कि नहीं, this is something very important. I have been into like a very noble profession and something which I have to learn. इसको तो skip नहीं कर सकते. So after second year, I was a little serious about things. And I had a keen love basically for the books, literature, writing. So gradually वो medical science में है ही ना, more patients you see, the more you read, the more you explore. So gradually वो love बस बनता चला गया. And during that time even I had some love for administration, academics था ही. So I used to get involved in all the paperworks of college and all those things. So gradually after this completion of MBBS, I joined through Public Service Commission the medical office job. और वो medical officer job में I just enjoyed all the administrative part. So वहाँ समझ में आया कि administration, academics ये दोनों mix up करके and it will be good for me. So I was in my UP job and at that time through the government part also you were supposed to give some examination and all. And my dad came to know कि exam है and you can have a seat via this exam as well. So gradually फिर वो orthopedics भी हो गया. So I was never interested in PG because I was enjoying my administrative part. But वो करते करते you never know what the fate is. So just one exam and then you are into orthopedics and job was secured. कि आप ऑर्थो करके आओ फिर जॉब तो है ही है, वापस आ जाओगे. बट वंस आई वॉज डन विद माई PG पार्ट, आई वॉज नेवर लाइक रेडी टू गो बैक टू माई जॉब. ऑर्थोपेडिक्स में इतना मज़ा आ गया था कि इतना कुछ पढ़ने को, इतना कुछ करने को, एंड एवरी पेशेंट इज़ अ न्यू पेशेंट, राइट. सो सब कुछ था एक्सप्लोर करने को. सो फिर उसके बाद आई लेफ्ट माई गवर्नमेंट जॉब एंड आई केम टू दिस प्राइवेट साइड.
Perfect. I think it's a very enlightening journey that you had. So, boss, why did you choose orthopedics as your career?
जस्ट 2 to 3 रीजन्स. एंड ब्रांच, दैट वॉज अ एम. कि पहला थॉट जो उस टाइम था दिमाग में, इट वॉज कि मेरे पास तो गवर्नमेंट जॉब है ना, वट एवर स्पेशलिटी आई में गो इन, सो आई हैव टू गो बैक इन टू जॉब. बट वंस यू एंटर ऑर्थोपेडिक्स, यू विल रियलाइज इट्स अ एंड ब्रांच. Whether you are doing MS, whether you are doing DNB, whether you are doing diploma, you are allowed to do everything. Like in other surgical branches, you always have to go for a super specialty part. MCH is there. Orthopedics में MCH नहीं होता. Orthopedics में in India we don't have anything which is like approved by MCI or by NMC. लेकिन बाकी डिपार्टमेंट्स में, सर्जरी में, OBG में, you have some MCH and further things which has to be done. So orthopedics is one end branch and you are allowed to do everything. And then once you're into this, then you can explore your domain, where you want to go, subspecialty, or you can say the division of orthopedics. You can choose for yourself. And most importantly, what I loved about orthopedics was, even if multiple patients are coming to me with same problem, I have the liberty of doing different kind of management for them. बाकी ब्रांचेस आपको ये लिबर्टी नहीं देती. इफ इट इज़ अ डिजीज ए, द ट्रीटमेंट हैज़ टू बी बी. ऑर्थोपेडिक्स में यू हैव द वेज टू एक्सप्लोर. सो दैट वाज समथिंग व्हिच वाज डिफरेंट.
Boss, you have done your fellowship from AIIMS. What was so special about AIIMS?
I'll tell you, I've done kind of 6 or 7 fellowships, trainings at different places. So this fellowship which I did at AIIMS, it was a trauma center. So and this was not given to me by AIIMS. This was given by Indian Orthopedic Association. So I was a very active member of IOA that time, and I applied for that fellowship, and I got eligible after like 2 years broadly of applying this. So I was given 2 options: you go to Sir Gangaram Hospital or you come to AIIMS, right? So obviously it was a lucrative thing to go to AIIMS Trauma Center. Gangaram, I know people, and it's a very prestigious hospital, no doubt in that. But when you compare a private hospital fellowship and a government hospital fellowship, so definitely I thought that was my mindset also. If it is AIIMS, it is trauma center, so it will give me more like advantage, more patient exposures and those things. So that was the thought process. And definitely when I came here for the fellowship, it was a wonderful journey that time as well. The trauma center, it had number of cases, and definitely number of PGs were more. But Dr. Vivek Trikha, I remember, so he was the one who was with me all through the fellowship part. So it was a wonderful one. So that was the only idea to come to AIIMS.
Boss, now we'll talk about orthopedics as a specialty. NEET PG counseling is going on, and students have a lot of questions and apprehensions about choosing orthopedics as a career. So my first question, a simple one, is what are the pros and cons of choosing orthopedics as your postgraduate branch?
So pros and cons, I'll tell you. See, pros of orthopedics, like I said, it is an end branch, right? That is the biggest, I can say, the tool which allows you to do anything you want. That is the biggest pro. Now, second part here in orthopedics is, if your skills are good, you can just practice this orthopedic part anywhere, right? You just need to have your own OT, maybe one OPD, and you can start with the things, right? You don't have to be dependent upon multiple team members or something. The con part is that you will take some time to stabilize in any of the regions of the country. If you are like in the metropolitan city, it might be a little difficult. It might take more time, and you are dependent upon multiple factors. Corporate में जाना है, अपना private setup करना है. So costing is one con. It will take some costing from you, maybe your land, maybe your hospital, OT development, that is a costing. And if you get associated with some corporate hospital, private hospital, it is going to take some time. In your private practice, it will take at least 3 to 5 years to tell people that I am a good trauma surgeon, I am a good emergency trauma or maybe knee replacement surgeon or the hip replacement surgeon or cold orthopedics part. So it takes some time. People take some time to trust you. It is probably not the thing with the medical part. If you are a physician, if I'm having cough, cold, heart disease or some diabetes or something, I know I have to go to a physician only. So they will not inquire कि कितने साल से बैठे हो, कितने साल से कर रहे हो. But once you are under surgery, people will definitely inquire about you. So it takes some time, it takes some money if you have to establish yourself as a private practitioner. And pros will be definitely on the upper side as compared to the cons.
Boss, I've got this a very unique question for you. And this was a question asked by one of our students only. So is this branch suitable for girls?
Why not? See, I'll tell you. There are certain medical colleges in our country, the orthopedics department, where it is mandatory for all the PGs that before you come to the orthopedic OPD, First, you have to go to gym. So 1 hour you'll have to spend in gym, and then every day you have to tell your HOD that yes sir, my attendance was there in the gym and I've done this particular exercise, right? This happens. Years back from today, it was a trend and it was a thought that it has to be a muscular person who has to be in orthopedics, because उस time पे ना developments हमारे पास थोड़ी कम थी. Now we have multiple instrumentations are good. Nowadays robotic things are there. C-arm is the biggest development we have. So पहले if you like see the dislocations, bone को reduce करना है, तो you need to have more power as compared to the patient. लेकिन अभी we have good anesthesias, you have like multiple procedures which can be done with ease. So now principles are above anything else. So nowadays, if you just see, quite some time back, head of the department of Dehradun AIIMS, it was headed by a female only, right? And she had like a wonderful career over there, and she has given so much into the orthopedic department. Okay, so nowadays it is just a myth that females can't come into it. We have so many students from our DBMs only who have opted for orthopedics, right? So now it is no more a game of muscles and all. It is all about the tips and tricks and some basic principles.
That's great. The world is changing.
Absolutely. Like you say now, OBG के अंदर males जा रहे हैं, so orthopedics में females are coming, right? So it is all about your interest, what you feel like. So don't look or listen to these things that it is not going to happen. It is a male dominant branch. Some plus and minus are always there. But if you're good, people will definitely come to you.
So now I'm going to ask you a very serious questions, because this is one of the biggest apprehension in the mind of our students. Is orthopedics a saturated branch, especially in the metropolitan cities?
My personal belief is this is a myth. देखो, in any of the medical colleges, the PG seat of every department is broadly same. So if there are 12 PGs in medicine department, there are 12 PGs in OBGY department, there will be 12 in orthopedics only, right? And I'll tell you, everybody might not be getting diabetes or hypertension, but everybody is going to get osteoarthritis, right? So ortho ke patients are never going to decrease, that is for sure, until unless the humans start not using their knee and they will stop using the knee or the joint area. So orthopedics will never saturate, that is for sure. And this is the biggest myth. See, metropolitan cities ke challenges are different. Costing is high, right? If you want to build up your hospital, if you have to have licenses and all, so costing will be high, and that is one challenge. Second, the layer of the people, the seniority level, which are sitting over there, definitely to reach to that level, you will take a lot of time. Now you are leaving your own village, you are leaving your own city, and you are coming to metropolitan. So costing, stress, loans, and all these things, they actually are the biggest trouble. But for when you say saturation, I don't think so there is any kind of saturation. You always have the scope of expand. I'll tell you, if you are becoming an orthopedic surgeon, so you can choose your specialty. If you don't want to go for replacement, there are very few surgeons who do very good Ilizaro. There are very few surgeons who do very good hand surgeries, very good spinal surgery. So now you have the bifurcation. So choose one. Stay to that. Why you want to come into that rat race of knee replacement or trauma only? Everybody is doing that. So choose a specialty and go to that part. So if you're good with something, then every hospital definitely will be. I have a very good friend of mine who is known for his Ilizaro surgery across, I can tell you the state of Madhya Pradesh. And he's going to all the cities of MP, right? A lone surgeon who is traveling to all the hospitals and the only one who is doing wonderful Ilizaro surgeries. So you have to have that skill set, right? So I don't think so. There is any kind, something like this. It is getting saturated. You should not be worried about that.
Boss, you were talking about orthopedics, that it is an end branch. Today, I have seen so many fellowships coming up in orthopedics, and even hospitals are demanding that after postgraduate, a student or a doctor basically needs to have some kind of fellowships. So is it right to call orthopedics an end branch? People are, expecting super speciality, not in the form of DM or MCH, but majorly in the form of fellowships.
See, we have to understand what exactly is a fellowship. Fellowship simply means a training in some of the part or some of the area of orthopedics, right? Now, some of the fellowships, they are paid, some are unpaid. If you are doing your post-graduation from a wonderful college where you have exposure to every kind of surgery, spinal surgery, replacement surgery, trauma surgeries, or maybe like, scopies, everything, if you're doing well, so why you have to go for a fellowship? Fellowships are only meant when you are not very much aware of a particular part, right? I'm not very good with the spinal part, so I can go for spinal surgery. Go only if you have a plan that you are going to do spinal surgeries only. Because what you are not practicing, you will not be recalling for a long time, right? So fellowships is not that required in, if I'll tell you another part of this. Medical Council of India, or now the NMC, they don't recognize most of the fellowships. I must tell you this thing. And you can't write on your prescription paper, on your OPD paper that I am a fellow of this. You have to write it down that this is my special training. This is my something extra activity which I've done. It is not my degree. right? So there are so many online fellowships. There are so many, you have to go and you have to pay for the fellowship. So this is not recognized. Majority part are not recognized, right? So fellowship is more or less, I can say, two purpose it serves. If you're doing fellowship from a very good institute, then definitely you are learning, which goes for a period of 6 months, 12 months, maybe 2 years, like that. Then you're learning something. But then you should go to a fellowship for which you are ready that you are going to practice that only. Pediatric orthopedics. I know so many of our students who are doing pediatric orthopedics now, right? Fellowships. So they have thought of their career in pediatric part only. Okay. So fellowship will serve another purpose. Your letterhead will be looking decorated, right? But decoration is one part only. If you're good with your skills, your patient will come back to you. If you're not good, they will look at your board and they will come once and then again they are not going to come to you, right? So fellowships, some plus, some minus is always there.
What are the best possible fellowships for an orthopedics doctor?
So in orthopedics, fellowships can be done in all the specialties. It can be done in trauma, it can be done in spine, in arthroscopies, maybe like in Ilizaro, hand surgeries. There are so many. So you can opt for any one of them. And every fellowship, I can tell you, they go usually for a duration of 6 months to 2 years, right? In India also and abroad also. Some paid, some free. They're always there.
What are the best possible institutes to do these fellowships from?
See, it all depends upon, there are private hospitals also and government hospital also, which allow you, right? And through like our orthopedic associations also, you go to the private people. If you're looking for name tags, then we have through Indian Orthopedic Association, we have very good hospitals like in this Gangaram Hospital at Delhi, AIIMS Hospital here. In southern states, Ganga Hospital is one. So these are very good hospitals. Nanavati Hospital at Mumbai, they're very good ones for different fellowships. Okay. But for any fellowship, I would recommend one simple thing. Choose the fellowship of your interest and the thing which you are going to do in your future. Don't just go because I have to have a name of a brand after my name, because you are spending some time over there, 6 months or 12 months of your life. So fellowship should always be selected on the basis of your future perspective, what you're looking from your side, right? So these are some of the good institute, and every institute will have a different kind of good fellowship, right? AIIMS has almost, trauma is wonderful. Like here, Gangaram Hospital is good in almost everything, right? The kind of academics, kind of patient pool they have. So they're very good with all the kind of fellowships.
So what do you think is the future of orthopedics after like 10 years?
It will be wonderful. Same like always. It's not going to change. So nowadays we have some new, additions to the orthopedic part. So that is going to make orthopedics much more better and advanced for sure. So if you say diseases are going to decrease, they are not going to decrease until the patient, they become, more educated and more conscious about their health and their routine, which usually lacks in our system. So nothing is going to go wrong with orthopedics. It is going to flourish like anything.
Which branch or subspecialty of orthopedics will have the highest, growth in the upcoming 10 years?
See, we always say that if we don't take care of the health, India will be diabetic capital. And diabetes people, they usually have muscle wasting, bone weakening, and that usually lead to arthritis, right? And that is why every orthopedician's first dream is to learn the replacement part, right? So replacement part are definitely are on the higher side, the obesity and all those factors. This is one. Looking at these highways and all those part, the trauma is now again increasing. And when I was a resident, I remember my hospital, it was a Delhi government hospital. It was on near to one of the highways. And we used to get a lot of RTAs, right? So trauma surgery, replacement surgery, they are always going to be like, in fashion. And we should always learn that how quickly you should be able to treat your patient, right? So we have multiple advancements nowadays. And we are able to save so many, like I can say, neurological deficits or the troubles of the patient, which in past were little difficult to save. But nowadays we have so many things. And we are getting good results with that.
Boss, let's discuss about MS Orthopedics and DNB Orthopedics. Now, I want to know the main difference between these two branches.
So basically in the MS part, you are in a medical college. So there the focus is on both the things, academics also, hands-on also, patients also. But DNB is usually being done at private hospitals. So more of the focus is on patients. More of the focus is on OTs. Now what about academics? So most of the DNB institute, they are usually lacking the academic part. So whenever you are selecting a DNB institute, make sure you have a good balance of academics as well as the hands-on. That is very much required. This is one of the main reasons that why in DNB usually the passing percentage is slightly on the lower side. Academic focus is little less, or they don't have probably good academic setups over there. That is one challenge. Duration for both the degrees is 3 years, right? But as per the NMC guideline, I can tell you, a MS candidate and a DNB candidate, they are at par, they're equal. They should be ideally treated equal. But in the real world, I'll tell you, when you go to the metropolitan cities and their hospitals, if there is a MS candidate and there is a DNB candidate, if they are in the interview, they are able to answer, kind of equally good for both the questions, all the questions there, then even the preference is usually given to a MS candidate, right? As per papers, on the papers, we know both are equal, but it is a like reality. We have to face the reality. It is the real reality that MS candidates usually given a edge. That is the reason again, DNB candidates definitely they feel like that I am not inferior, then why should I be treated like that? Okay, so that is one challenge. That is a practical aspect. But on papers, yes, NMC says both the qualifications are equal now, right? So this is one challenge they have to face.
If a student wants to judge if this college or an institute is good for orthopedics, what are the parameters that they should keep in their mind?
So when you are choosing a college, you just have to see a few things. How good is the academics? How old is the college or the hospital? And how frequently they are conducting class? Because theory definitely is important to make you pass the exam. Second part is about the hands-on thing. How many patients they see per day? What is the OT and OPD ratio? And what all cases they are doing. If they're doing kindly okay with all the segments of the orthopedic part, then it is a good to go hospital. That way you have to select.
So, boss, can you tell us the 5 best colleges for MD and DNB orthopedics in India?
See, if you talk about Delhi, I can tell you right now. So definitely AIIMS is one, Safdarjung is one, RML is another one, MAMC is another one. These are good. In Delhi, we have the government hospitals only. But when you talk about DNBs, Gangaram definitely is one of the best we have. All the good academics, all the good, hands-on, all the kind of patients. Then we have Stephens Hospital. Then we have DDU Hospital. Nowadays, Ambedkar Hospital. It is in Rohini. It has been declared now as a medical college. It is doing very good. So patient crowd in these hospitals are very good. If you talk about southern states, Ganga Hospital, Coimbatore is a very good one. In West Bengal, there are few hospitals, right? And in Delhi only, there is a Holy Family Hospital, I think. It is in South Delhi. It is running the DNB, this course for last so many years. And they have got very good results, good patients, good corporate care. In every state, they usually keep on changing, right? The number of seats and the kind of academics. But yes, Mumbai Port Hospital is very good one. Okay, so state to state, they will vary. But for Delhi, these are few very good colleges we have.
Boss, now we come to the most demanded question of our podcast. It's very simple. All right. How much does an orthopedician earn? As an SR, as an orthopedician after 10 years, after 20 years, in government setup, in corporate setup?
So for the SR, the salary at present is somewhere near to 1.4 or 1.5 lakh, right? Which is usually stagnant and it depends upon the central government schemes and it keeps on increasing 10%. After senior residency, you are given residency for 3 years. Then you can apply for some professorship or something in a medical college, or you can stay as a consultant. There you can earn easily some 2 to 3 lakhs. That is a beginning part after your 3 years of residency. If you say 10 years, if your skill set are good and you are developing towards one of the segment of orthopedics, then easily every month you can get some 4 lakh, 5 lakh. That is a normal, money which you can make. Depends upon how many days you are ready to work. And after 10 years down the line, you reach to a level of a consultant. Now you are not getting paid by hospital. Now you have to generate the money yourself. And it all depends upon how good you have been in the last 10 years. So if you have been very good with your patients, your patient pool is good, then there is no limit to the money. Right? So consultants, you can't have that limit. It is beyond anything.
Boss, what are the career opportunities for an orthopedician in the corporate sector?
See, in corporates, you always have to work as an orthopedician only. There is no other way. So first you go there as a senior resident, then you go as a junior consultant, then you become a senior consultant. That is the sequence in seniority levels in the private hospitals. Okay. So like I told you, SR will be paid by hospital. Junior consultant or a senior consultant, it will be paid by the hospital as per the patient load. So here you have to work for yourself. That is the only perspective you have in private setup. In private, nowadays, I've seen people are coming up with some of the literature, some of the unique things, and they collaborate and they just, present papers in the local conferences or all. That is the maximum they can do. But definitely when you talk about the education part, if a orthopedician is somewhere related to education part, like in medical colleges, they have to present the papers, they have to present the posters. So they're always academically oriented as well as, linked to your patient pool as well. So there you have a scope of growing to multiple dimensions. You select one of the domain that my unit is only doing trauma. Other unit is only doing tumors. So there is exponential growth in that part. You can keep on exploring the new things. You can keep on presenting new papers, new ways. So there you have the scope. But in private setup, you can only work upon what are the fixed guidelines because you are answerable to people. They are paying you. So in corporates, not much of the scope. But yes, in medical colleges, definitely. There are so many things you can do.
If we talk about core government jobs, what are the opportunities there apart from the medical colleges?
In government jobs, if you are an orthopedician, see, you get into the orthopedic system by 2 ways. Either you go in directly into the orthopedic department as a faculty, or you come through public service commission. So if you are a public service commission fellow in orthopedics department, you will be taken after a few years into administrative part, right? So you are taken there in the administrative part and you will be doing the paperwork. So you'll be assigning, tasks to the team. That is one prospect. Other one is to become like starting from the senior resident. You become an associate professor, assistant professor, like that. Assistant is the first one, associate is the second one. Last, you go to the HOD level, the professor level, and you can become the head of the department. So these are 4 or 5 steps you have to follow, and that depends upon your experience every year's wise that you how you go.
What are the business prospects in this field?
When you talk about the business prospect, it only happens when you're into the private setup, because in government part you're not allowed to do that. So you can have your own, maybe the industries or the factories or the the you can take the franchisees of the implants, or you can have your medicine franchisees. So these are two things in orthopedics part. So you open up your pharmacy part, you open up your implant part. These are two things which you can do. There is usually don't get time other than these two.
Was you have started your own hospital. It's running very well right now. You started small, but now it has turned to a multi-speciality hospital. So if a postgraduate, any postgraduate, not just orthopedician, if any postgraduate wants to start, even think of starting their own hospital, what are the key things that he or she should keep in their mind?
See, if you have to, I can tell you my experience. If you have to tell it yourself, if you have to start it yourself, right, not taking money from anybody else, then you should start planning early. You should start saving money when you're into senior residency. You should start thinking about when to take loan, how to repay it from that time only. And if you have that probability of going ahead with the loan and then setting up your land, setting up your building part, so start doing that from the residency part. Because once you are in the residency, you have that fixed income for at least 3 years. After that 3 years, you'll be looking for another job, another money part and all that thing. So that stress should not come. So if you are getting 1 lakh rupee, at least 50,000 you can easily put there. You take a loan of 40, 50 lakh or a 1 CR part. So that can be partly taken care of in your residency, right? That is one. Second, you should always be very vigilant about what all documentation is required in your region. If you're in Delhi, if you're in Mumbai, every state has their own rules. So go through those rules before you plan to start a hospital at any of the locations. So once you take a location, you are bound. You have taken a loan, you have spent money, you'll be bound there. So whichever city, whichever state you belong to, read the rules before starting that. And gradually, once you start, go step by step. Don't try to put all the money there, that you are putting all the OTs, all the CM, all the OT machines are, lavish ones. So start with the basic part, start with your OPDs, start generating patient load, operate them somewhere else, right? And once you are good enough, you are sustainable enough that my patient pool is good, now you can go ahead with second part of the loan or third part of the loan and then go with the machinery part. So don't put too much of load on yourself. Only put that much of load which you can easily repay from a fixed income part. So this is one piece of suggestion for all of the people who are planning to start the hospital.
So if somebody wants to start, what should be the minimum bed capacity of that hospital?
See, it again depends upon state to state. In Delhi, we can have an ophthalmological setup with 2 beds also. But when you talk about multi-speciality, it has to at least go beyond 12 beds, right? So what is the difference in a nursing home and a hospital? Hospital is usually called as that one which has more than 100 beds. We have a nursing home, less than 100 beds are nursing homes, right? So when you are going with multi-speciality, you have to have a differentiation in the segments. OBGY has to be different with the labor room. So think about your probability. Are you able to afford 1 OT or 2 OT or 3 OT? So just think of your part. So it is good to go ahead with 10 beds only. Initially, it is good, fine one.
So what is the minimum capital required to basically build a 10-bedded hospital / nursing home?
With land or without land? Land
Let's
cost.
suppose with land.
So with land, again, it depends upon metropolitan. In Delhi, it's too costly, right? So land depends upon area to area. In Delhi, if you want to start with the 10-bed hospital, you need minimum some 100 square feet by 100 square feet area. That is quite big. But then specification here in Delhi are little tight, little rules are very strict. So I do believe it will take minimum 1.5 CR, minimum. That is a costing to start with the basic part.
And in periphery?
In periphery, you can start with a decent amount because land costing will be little less. So you can start with 60, 70 lakh rupees. That is what I believe. Because nowadays people don't usually buy land. They take it on lease for a long time, 10 years, 15 years, 20 years. So on that, you can start constructing with the help of the landlord or somebody. You can have a partner. So people are, instead of investing on the land part, they are more focused upon the infrastructure part. So that is another way to start the hospital.
So does the government actually help in procurement of that land? Do they give any kind of subsidy?
Not to private hospitals, nothing.
Okay, nothing at all.
Nothing at all.
What is the minimum requirement to basically build up an orthopedic setup?
A requirement in the sense of?
Both capital and what should be the minimum things required to build the orthopedic startup? Which is basically if they should have an OPD, how many OTs, what should be the basic requirements in that OT?
See, I'll tell you 2 things here. First, answer for your question. See, if you want to start with the orthopedic part, Minimally, you need one OT, one major OT, which has to be a very good one. Because in orthopedics, we are very worried about infection part. So your OT should be very neat and clean. So you need to have at least one good orthopedic table. You need to have a C-arm. You need to have a very good anesthesia trolley. And these three are the major things. Then good OT lights. Then you have the instrumentation set. So that easily cost you somewhere around 35 to 40 lakh rupees. That is one part. Second is about the OPD and the basic requirement in your emergency area. So that will again take your kind of 15, 20 lakh rupees. So that makes it like 50, 60 lakh rupees. This is the minimum requirement for orthopedic things. You are starting with the orthopedic OPD, with the orthopedic emergency part and the orthopedic OT part. This is one. But saying that, I'm telling you, if you start only with one specialty, it will be very tough for you to sustain your hospital in the initial days. So initially, you must have at least 2 to 3 colleagues with you, one physician who will always keep on rotating the patient in the hospital, then the surgical part, which is going to take some time to develop. So initial revenue always comes from the physician part. The surgical branches will take some time to get some revenue for you. So this is one very important thing everybody should know. I started with the orthopedics part and I was little struggling for kind of a year or so. And then we made it multi-specialty. So we started having the rotation of patients, right? So revenue generation is very important in the initial part. And this is one lesson we learned.
So basically, more of collaborations are required to actually run a successful.
100%. It is always required. Instead of having a single specialty, you should always have a multi-specialty.
So, boss, what do you suggest? Should a person buy the land in which they are building their setup or a hospital, or should they rent it out?
I do believe buy it, because rental part is always what kills. Every month on a particular date, you are under the stress to check your bank balance that my EMI is going to get deducted today. So if that EMI is supposed to be cut, why not for a bank loan and why not for a land? So first, it should be my thing. That is my preference. That is my way of working, that it should be my thing.
People are, many times confused. Even if they want, if they have the capital, they want to start up, set up a hospital, but they're confused about the location. How should a doctor decide the best suitable location for their hospital?
See, the best thing always is to go there as a patient. Think of it. If I am a patient, I like to go to that location. So if you're not able to easily go to that location, why your patients will be coming? Second part is, when you are selecting a location, make sure that how many hospitals are in the nearby vicinity. And if you're an orthopedician, how many orthopedicians are sitting over there? What is the population of that area? Right? These are three important parameters. Don't sit at an absolute distant location where there is nobody, no population, no surgeon, nothing, and you're sitting alone. Nobody is going to come to you. So if you have that probability that my land, my hospital is little distant, so start your practice from the crowded area. Have a single OPD there. Tell people that I'm here, I'm an orthopedician, and operate somewhere else. Maybe it will take a year or 2 years or 3 years. After 3 years, if you're doing good work, people will look for you. And then you can go anywhere you want. Then people will follow you. But initially, you have to be in the market. You have to tell everyone that I'm there. But don't put too much of money over there. Put your money, keep a definitely substantial amount safe for yourself. Always. Above that, play any gamble, whatever you want to. Right? This is something which we have to do in the private practice.
Boss, we have been talking about hospitals and nursing homes, but I think that's a big gameplay. If a normal postgraduate wants to start their own clinic, what should be the things that they should keep in their mind?
In clinics, you don't have much of the trouble. You just need to have a neat and clean OPD and a wonderful reception area. That is all is required. In basically now this OPD part, you can always have a rental one. It is not killing much. Rentals are not very high. And if you know that this is my area or my place where I can have good patients, so you can easily, get that money from your patients. That is absolute normal thing. So this is not a very something which should be bothering you or troubling you.
So how much capital is required to build a simple clinic?
Not much, kind of like 8 to 10 lakh rupees or maximum 15 lakh rupees. That is a very high price, I'm telling you, for a very decent ambience, decent look. That is more than enough.
When should a postgraduate start thinking about setting up their own clinic? Like in today's scenario, is it good to take a job after internship, or should they directly jump to open their own clinic?
It all depends. See, first impression in the market, it always survives for a longer time. Not because you are there or you're not there, because your competitors are there. And it is your competition is not basically because with your colleagues. It is with the non-medical people who are spoiling the market. So they will look for a reason to spoil your name. So if you're good with your skills, if you think that my college has been a good one, decent one, you can start with your practice. No harm in that. But if you think I need some more training, please accept it, that I need some more training. Go for the senior residency and then come back to the market. Don't just jump because I have to jump. You have to be very honest with your patients and with your treatment part. Then only the patient will turn up to you.
You have grown in multi-speciality of yours itself, not the hospital. I've seen you grow in the last 10 years itself. You have become a brilliant orator, you are an educator, you have, developed your own business and everything. So what are the skills that you can recommend to our students that if they really want to grow up in their life, these are the skills that they must instill in themselves to actually not just be dependent on the degree, but look at life as a larger picture?
See, it always depends upon what you are looking from your life, right? So I always wanted to do multiple things. I love doing that. And if you're the one who is looking for something additional other than your routine life, then you must start thinking about it. See, everyone has that one extra edge, extra thing which you like, right? So if you know you love academics, start writing something. Someday you will realize that this part is not good and probably this is good. If you want to start teaching people, start teaching your colleagues only. I used to teach my own colleagues at my medical college, right? So someday you will realize that what part you are good at. So you should always have, like, don't put always your all the eggs in one basket, right? This we all know. But if you're good at something, you have to explore it, and this has to start with your medical college life. If you're in your third year, final year, internship, think of it. We know so many medicos going into the civil services. They have their love for administration, so right, they're cracking it. So you have to explore from there only. See, once you are into the life after medical, the MBBS degree, you are having so much of responsibility and you get so much of stress that should I change it or no, right? So that changing the path is always a possibility without a stress only in your medical college, because you only have to crack the university exam. Nothing more is there in the third year, final year. But then how much oriented you are, how much focused you are, what you are looking from your life, it all depends on that. So see, if you have to grow somewhere in other dimensions other than your normal orthopedic part, so you have to be socially very active. In most of the conferences, you will see people are not going there. और जा भी रहे हैं तो क्यों जा रहे हैं? चलो खाना खा के आते हैं. चलो, you will have some good time together. But it works. When you go out there, no, you meet people, you are increasing your network. And that is your biggest asset. You never realize this thing कि मैं उसको भी जानता हूँ, उसको भी जानता हूँ. That only happens when you're knowing. Second thing is, nowadays, the tradition is more about the social media presence. If you are not present there, at least know who is the most active person, on the social media. You should know that, because social media platform is the easiest and the quickest way to connect with anybody. Third thing, you should be financially sound. Doctors की सबसे बड़ी कमी, we never know about the finances. हमें पता ही नहीं होता सैलरी आती है कहाँ जाती है, नहीं पता लगता है ना. We are only focused upon the FDs part. उसके बागे शेयर मार्केट नहीं पता सर, we are not interested. और कुछ कर लो, SIPs कर लो सर, वो क्या होता है, I don't know. How to save the money, I don't know. सर किसी ने कुछ बोला कि यहाँ पैसे इसको दे दो, दे दिए, क्यों दिए, we don't know. Right? So financially you have to be very, very sound, and you should understand, if you are a doctor and you are getting good number of OPDs, हर किसी से OPD फीस आ रही है, OT के पैसे आ रहे हैं आपके पास, and if you are not able to manage that money, तो फिर entrepreneurship वाली skill तो कभी आएगी नहीं. So you have to think about the financial part. So many courses are there. If courses are not required, entrepreneurship is not something which is dependent upon your courses. People say entrepreneurship का course नहीं किया तो कैसे करूँ? Entrepreneurship is something which you learn from your basic school. कि आपको मम्मी ने 10 रुपए दिए थे, आपने क्या किया उसका? Right? So this is something you have to learn with time. If you want to go a little step ahead of something, you have to go somewhere in the different dimension, right? And look around for the people who are doing little different things. देखो उसमें से आपको क्या मैच करता है, आपको क्या उसमें से लगता है कि lucrative है and I can do it too. Try doing that. Okay, so once you start doing it, कुछ चीज़ें होंगी, कुछ नहीं होंगी, but at least you will come to know what you are good at. Few things you will learn and you are going to go ahead with that part.
Great, boss. Now, for the last question of the evening, before we move on to the rapid fire round, and this is again a question which is, most demanded by our students. Second most demanded, I would say. Which do you think actually will be the top 5 specialties in the next 10 years?
So when you look down the line, the medicine and this surgical part has to make a balance. But the thing, looking at our current scenarios of the diseases which are happening, I think cardiology is one thing. I'm not talking about the surgical part, but the medical part, right? So DM cardio is one of the upcoming branch. The nephro is one of the upcoming branch. So these two, I think they are gaining a lot of momentum these days, looking at the kind of problems patients are facing, especially post-COVID. Okay, and in the surgical part, I do believe every branch has to play an important role. But then orthopedics stays as an end branch, which I told you. Right, the problems which are increasing. Then second, I would say the laparoscopic surgeries from every part of general surgery, they are getting the momentum. So with the minimal incisions, with the robotics coming into the picture, so general surgery with its laparoscopic part. Now you can call it from the gastro end, you can call it from the endo end, or any of the ways. So these two things, I would say, that Department of Medicine and the part of surgery, these are going to be the very good ones in the upcoming time.
Thank you. I think we missed one important question, so I'm going to ask it right now. What would be your advice to a new JR1 joining orthopedics? How to handle the pressure, the toxicity of the orthopedics department?
So every JR has to understand one thing. You will be probably by this time you're joining your JR1, you are kind of 25, 26, 27, 28 like that, right? And you are not going to stay in this medical college for the whole life. You are here only for 3 years. So why not to take the positive part only? Right? So we always win or lose any battle in our mind only first. So have a catch of your mind. Please understand what is the best in that particular medical college. Take that from your professors, from your HOD, from your APs. Take the best part. In the first year of residency, don't even feel that somebody is going to give you the knife. Usually don't get it. If your seniors are kind enough, they will give you after some 6 months, 7 months, 8 months, they will give you the knife. But for initial part, first understand what is orthopedics. Don't just jump that I have to operate, I have to, cut down a patient. Don't jump to that. Try to understand how orthopedics is balanced, how literature has to go one by one, how the patient has to go one by one. Start from the cold orthopedic part. So if you align yourself with the department, you go with the flow, it will be easier for you. If you try to go your way against the tide, it will always be painful. So go along with the tide. It's a matter of 3 years. Take the positive vibes from that.
So, boss, let's move to our rapid fire round. You have played it before. The rules remain the same. 2 simple rules. You have to speak the truth and you have to be super spontaneous. You don't have to think about it. All right. What's your favorite thing to do on the weekends?
Just read or sleep. That is my favorite thing.
Would you rather read a book or watch a movie?
Read a book.
Which one have you read the last?
My orthopedics book.
What's the best gift you have ever received?
A beautiful pen. And I have love for pen and diaries and all these things. So pen, definitely, I'm in love with pens.
Which pen was it?
It was Schoffer.
What's your biggest fear?
So my biggest fear, I can tell you just one, that, once I'm taking a class, my students should always be happy and they should be content that they have read good orthopedics. And still after 10 years of teaching, still I have that fear that I should be delivering the best of the things. So that is the only
मौत के बारे में सोचते हो?
कभी नहीं. I don't fear that thing.
I wanted to do this for a long time now.
ये मतलब आ रहा है खतरनाक वाला वाला.
मौत के बारे में सोचते हो? What's your favorite sport to watch?
Usually cricket only.
कौन है favorite player आपका?
Virat Kohli, everybody's favorite.
Even after BGT?
After anything. After anything. See, bad phases are for everyone.
True.
So that doesn't mean that he's not a good player. He has given, such a young age, when he lost his father, he has come back into the cricket, and the things that he have got in cricket, entertaining all of us for such a long time. So that is something special about him.
Which player do you think will be the best in the next 5 years?
I don't know. I have no idea about this thing. There are so many turmoils going on. So Rishabh Pant is a one upcoming one, but he keeps on doing some things up and down, which makes himself insecure that whether he's going to stay in the team or no. But he's one of the very good players.
I think Nitish Kumar Reddy has shown
He's
great
upcoming.
potential.
He has a potential, but given an opportunity, definitely he can do wonderful.
What's your biggest accomplishment?
I think whatever I have achieved till date.
Huh.
So everything is going on. Never thought of anything like this is my accomplishment or something. Never thought of that thing.
If not a doctor, what would you have been?
Probably a lawyer.
A lawyer.
Probably a lawyer.
What's the happiest moment in Dr. Sushil Vijay's life?
My daughter's birth. That was Shreya's birth, basically. So her birth gave me that reason to, start feeling like, you have something of your own and you have to take care of somebody like that. Marriages are something where it happens. Parents told you that, marriage is going to happen. So there you don't have that feeling initially or instantly. But when I had Shreya with me, so that was something which changed me a little. So that was a wonderful feeling that time.
Well, thank you so much, boss, for this insightful discussion. You have told us everything very clearly about orthopedics. आपने हमारा पूरा दिमाग replace कर दिया आज.
But thank you so much, Dr. Nachiket. And this video is something I can tell you. If somebody asks me about orthopedics, I can just forward this link now. This is wonderful.
Yeah, the way you have discussed about setting up a hospital and everything, that is also very, very insightful, because so many times I get students who, ask me how to set up clinics, private practices or hospital. But somebody who has done it. So you have very clearly told us this is what is required. This is what minimally you have to do. And, every step a student wants to take and there's somebody to guide them, what, can be better than that?
Absolutely. True.
So if we can, help somebody set up their own practice, I think the whole concept of this podcast would have, be very, I will be very happy.
that will definitely happen, I can tell you. People can take, suggestions from this podcast and definitely they can go ahead with that.
Thank you so much, boss. And thank you so much, guys, for watching today's podcast. I believe everything you wanted to know about orthopedics has been laid out very clearly for you. No more gray area, just black and white. And who do you want the next guest to be on our hot seat, please put in the comment section. And as always, I always ask help from you. You have to send the person, that legend, a simple message from your side that please come on our show. So thank you so much, everyone. God bless you and best of luck.